The 2017 calendar year for the Ministry of Health was a period of major accomplishments and strides towards improving public healthcare delivery. Patient customer care service delivery was boosted during the year as the Public-Private Pharmacy Partnership Program reached into Kingston and Montego Bay, reducing waiting times to fill prescriptions from the public health sector.
During the course of this year, we are going to ensure that we have this public-private arrangement in 50 pharmacies across Jamaica.
In June, the Drugstore Pharmacy in Greater Portmore was opened after a $42 million upgrade financed by the NHF. Throughout the year, the ministry also expanded its program to reduce waiting time at hospital A&E departments.
We have seen thousands of patients now going through the health centers as opposed to the accidental emergency, and that waiting time has in fact been reduced.
In 2017, the National Health Fund began providing new drug subsidies to treat breast cancer and arthritis. Kicking off the year right, the Jamaican and Chinese governments signed letters of exchange in January agreeing to commitments for the construction of a children's hospital in Western Jamaica. In October, the government signed an economic and technical cooperation agreement with China for the 220-bed facility, plus a technical assistance agreement with the United Nations Office for Project Services. And as that facility advanced towards construction in the past year, a $25 million low-vision resource center was completed and opened by the Jamaica Society for the Blind at Old Hope Road. In April, the health center received 6 ambulances as part of a €22 million European Union grant towards the program for the reduction of maternal and child mortality, PROMAC. Health workers were also trained to operate the units. During his sectoral presentation to Parliament, the Health Minister announced a $3.5 billion program to upgrade critical health infrastructure.
We cannot continue to limp along with an ailing infrastructure and pretend that we are able to respond to the health challenges that our people face. We have to do something about it, and we have to start now.
$1.3 billion was approved by Cabinet in 2017 for the recovery project at Caenwood Regional Hospital, and an engineering firm was contracted in May to design a new custom-built ventilation system. Cabinet also approved $619 million for major capital spending on other hospitals. Meanwhile, the Mandeville Regional Hospital's Ear, Nose and Throat ENT department welcomed the donation of a pediatric esophagoscopy from the Manchester Wellness Foundation.
This equipment that you're providing will save lives.
In April, the ministry officially opened the fully renovated Hagley Park Road Health Center, done at a cost of $42 million.
It is what we want to do to take primary health care to communities like this one across the country.
In July, a new Western Regional Health Authority facility was opened in Montego Bay to accommodate the full complement of the regional authority staff. The region also benefited when the newly renovated operating theatre and male surgical ward at the St. Anne's Bay Hospital were opened in October. In October, the Health Ministry signed a multi-million-dollar contract to repair a leaking roof at the Maypen Hospital.
Today, with this $54.7 million contract roof repair signing, I believe it is another step in our responsiveness to what is required, and we're happy to be moving this process forward.
In the past year, the Kingston Public Hospital was gifted a state-of-the-art laser machine to improve access to corrective eye surgeries. More gifts to the sector included $12 million in medical supplies to support the Caenwood Regional Hospital Recovery Project, outfitting of a state-of-the-art learning center for long-staying patients at Bustamante Hospital for Children, and a $3 million facelift of the Ramble Health Center. Meanwhile, a biodigester septic tank was constructed at the Noel Holmes Hospital and its general and maternity wards were upgraded. An agreement was signed with the United Nations Office for Project Services in October to provide technical assistance for the upgrade of 5 hospitals. In the ensuing month, the Health Ministry was again signing contracts to replace outdated elevators at the Kingston Public, Spanish Town and National Chest Hospitals at a cost of $44.9 million. And in November, the ministry launched its Adopt a Clinic initiative to encourage private persons or companies to contribute to the upkeep of 100 primary healthcare facilities.
I am happy to announce that so far we have had 50 expressions of interest in 50 such facilities.
Another milestone achievement last year was the official opening of the National Cancer Treatment Center at Caenwood Regional Hospital. The modern facility with state-of-the-art equipment was established at a cost of $15 million.
It is more precision technology, and therefore the chances of recovery and not damaging other healthy cells in the body are much enhanced.
We will have a national health insurance policy. We will signal to the country in the next financial year how that policy will look, how it will be phased in, and frankly speaking, how it will be funded.
Additionally, in 2017, a 6-month contract was signed for the development of a policy proposal for the introduction of a national health insurance scheme. Last year, in the fight against non-communicable diseases, the Jamaica Moves campaign to get Jamaicans into regular physical exercise and good nutrition habits took center stage in a number of town centers. The fight against vector-borne diseases was bolstered with the opening of a mosquito control and research unit at the University of the West Indies Mona campus. A social marketing campaign dubbed Test and Start, Get on Your Meds and Get On With Life was launched to encourage persons to get tested for HIV/AIDS and to take their medication. And the National Council on Drug Abuse launched a national public education campaign dubbed Talk the Truth, Our Future Comes First, and signed a multi-sector agreement to help youth stay away from drug use. During 2017, Cabinet began reviewing a new policy and strategic action plan for national infant and young child feeding. Cabinet also approved amendments to the Pharmacy Act to allow nurse practitioners to prescribe up to a certain point medication to patients who have particular symptoms.
That amendment, by the way, also includes bringing into the process things like nutraceuticals, pharmacy technicians, and what their role is and so on. So it's a comprehensive review.
And that's our look back at a year of strong performance, building prosperity in Jamaica's public health system.